The next bone we're going to look at is going to be a portion of our pelvic girdle. If you have been following and watching these tutorials, we already have covered the pectoral girdle. Now we're going to move into the hip, the pelvic region, and the lower leg region. So this is an os coxae. Our two os coxae form joined together to form our pelvic girdle. This forms a nice, solid, stable joint to the sacrum. The sacrum is going to join in here. This is our SI, or sacroiliac joint. Right here is our pubic symphysis. This is where our two pubic bones are going to fuse in. There's a nice fibrocartilaginous pad here. It forms an amphiarthrotic symphysis type of joint that gives you some flexion, especially during childbirth right here. So this is right here, this SI joint is where we're going to attach to our axial portion of our skeleton. Now, if you think back to the pectoral girdle, we used that little clavicle really to tie into the acromion as our point of attachment to the axial. Now this is going to be weight bearing. The sacrum will tie into this huge massive joint. Again, the SI, sacroiliac joint right here, forming a nice tight bond. So let's go through some of these features and structures. I need you to realize that this os coxae is a fusion of three bones, and this is what I usually like to do. I like to start at this big depression right here, this acetabulum. Now this acetabulum, if you use this as your landmark and essentially start here, draw a line up and cross this acetabulum in half, draw essentially a T. This kind of shows you how the three bones are fused, because the fusion of the three bones kind of meet right here in that acetabulum. So the posterior aspect of this os coxae is your ischium. You have your ilium up here, and you have your pubis, or pubic region, right here. Okay, so again, pubic, ischial, and iliac. So iliac, ischial, and pubic regions. Again, fusing and meeting right here in the acetabulum. So let's go through each and every one of these bones and look at some of our important landmarks. So we'll start with our two most prominent ones. We've already identified this as being our acetabulum. We have this hole. This is known as our obturator foramen. So nerves like our obturator nerve will move through here. So obturator foramen, acetabulum. Let's look at our iliac bone. We have our iliac fossa. It is this nice, broad, flattened valley of bone. And here's our spines that we have identified and talked about before when we looked at identifying and differentiating male from female. So we have two, and this is all going to be directional terms. It's on the iliac region, so we have our, this is the front, anterior, superior iliac spine. This is going to be our anterior, inferior iliac spine. This crest of bone will be our iliac crest, so iliac crest. And if we have a superior anterior iliac spine, then by rule and common sense, we should think that we have a posterior superior iliac spine, as well as a posterior inferior iliac spine. Now, as we move our way down, you're going to see that there's a couple more notches. There's a big one and a little one. This is the posterior aspect of our bone. So this will be our greater sciatic notch. That massive sciatic nerve is going to move through here. We have our lesser sciatic notch. So again, greater sciatic notch and lesser sciatic notch. This big rounded protuberance that we see is going to be, again, look what bone it's on. It's on our ischium, so it's our ischial tuberosity. This is your butt bone. Every time you sit down, this is essentially what you're sitting down on. We have our pubic bone, our ramus of our pubic bone. You have your pubic symphysis. Okay? And that pretty much concludes and finishes all our bony landmarks and features on our, this is a right os coxa.